Hi, my name is Erica Oler, and I'm going to be demonstrating a Foley catheter insertion using Sterile technique. The first thing I'm going to do is check my provider orders and make sure that a catheter has been ordered. And it has for my patient, Charlene Knight. So I'm going to go into a room and assess her to make sure we're able to put it in this time. I'm going to perform hand hygiene. Knock, knock. Hi, Ms. Knight. My name is Erica. I'm going to be your nurse today. Can I have your first and last name and date of birth? Charlene Knight, 8839. And can you tell me your allergies? Latex, penicillin, grapevine. That matches my provider order, so I'm going to go ahead and assess her this time. Okay, Ms. Knight, I heard that you've been having some discomfort and have been able to void in the past 10 hours. And your doctor has ordered that we get you a catheter to help relieve that. So, yeah, I'm going to assess your perineal area and make sure we're able to put it in right now. So I'm going to perform hand hygiene. Put on sterile, clean gloves. So I'm going to note that I can see the external meatus. The area looks clean and free of lesions. I'm going to palpate her bladder, and I note some tenderness and bladder distension. So I'm going to go ahead, Miss Knight, and get everything set up, and I'll be right back. I'm going to position her. And perform hand hygiene. So I'm going to get a sterile kit and make sure that my area is clean and dry. I see here that this is a 14 French catheter, which matches my provider orders. There's no tears or breaks in the bag. Nothing in here my patient is allergic to, and it is not expired. So I'm going to go ahead and open it. Set it down. Let me fold this up. Let me go with cash files of it on. Okay. Now I'm going to open the first flap furthest away from me, making sure to stay on the 1-inch border, making sure that the paper does not fold back on itself. Then I'm going to do the left side, and the right, and the one closest towards me. Now I'm going to adjust it, so later on I'm able to put my gloves on, making sure not to touch across the field. With this out of the way. Okay. Then I'm going to grab my drape, the shiny side, 1-inch border, and step back, making sure that the shiny side is facing me. And I'm going to go around. Okay. And come over. Shiny side facing down, and drop it. And then come around and adjust it, making sure not to cross the sterile field. Okay, next I'm going to put on my gloves. I'm going to perform hand hygiene, making sure neither of my sterile fields are out of my view. Grab my gloves. I'm going to come over here. Making sure that the paper does not fold back on itself. Okay, I'm right-handed, so I'm going to pick up my right glove first and step back. I'm going to have my hands supine, and I'm going to put my first 4 fingers in first. Then my thumb, making sure to only stay on the cuff. My gloves broke, so normally I would get a new pair of gloves, but for the sake of the video, I'm just going to go ahead and use them. Okay, staying on the cuff. Then I'm going to grab my next cuff from underneath and step back. I'm going to stick my first 4 fingers in first, and then make sure they're on nice and tight. I'm going to move this out of the way. Then I'm going to grab my white sheet, which is sterile, but I'm still going to stay on the 1-inch border and step back. Open it up. And set it on my patient. Okay. Now I'm going to move my box, keeping it within the 1-inch borders, and move the tray to the side. Okay, I'm going to grab my hydrogen peroxide and pour it over my cotton balls. Go this way. And then I'm going to grab the lube. I'm going to move this off of my sterile field because I don't need it right now. And put it in the corner of my box. Then I'm going to unsheath my catheter, making sure to stay in control of it so it doesn't fall out of my sterile field. I'm going to put it in the lube. Next, I'm going to grab my syringe and note that there's 10 milliliters of sterile water. And now I'm going to exercise the plunger. And I'm going to put it into the green quart, which I note can hold 5 to 10 milliliters of sterile water. And for this particular model, I do not need to exercise the balloon, but I need to note that in some models I might have to. And now I'm ready to go into my room. I'm going to hold the sides of the box over here and drop it. I'm going to hold open my patient's labias using my non-dominant hand. My non-dominant hand is now unsterile, and I'm going to clean her perineal area. So I'm going to start on the outer labia, cleaning from clitoris to anus, and then coming around my sterile field and discarding it. I'm next going to move to the labia closest to me, cleaning from clitoris to anus, coming around, discarding it. Next, the middle, front to back, coming around, discarding, and then I'm going to do it again. Closest labia, around, drop it, and the one in the middle, front to back, drop it. And I'm done with these, so I'm going to discard of these. And I'm done with this tray, so I'm going to move it off of my sterile field onto an unsterile field. And now I'm ready to insert the catheter. I'm going to make sure it's nice and looped. Hold it 2 to 4 inches down. Okay, Miss Knight, you're going to feel some pressure. I'm going to insert it into the meatus, making sure not to touch the skin. And bear down. So I'm inserting it. I note that I hit some urine, so I'm going to advance the catheter 1 more inch and stabilize with my non-dominant hand. And then going to blow up the balloon. Tug and make sure that it's in the right place. And it is, so my sterile procedure is done. I'm going to attach the syringe. I'm going to place it here. I would attach this to my patient's thigh and then put the bag down on a non-movable part of the bed to make sure, below the bladder, to make sure it doesn't move. And that's it. And I'm going to go document.